Welcome to South Brunswick Reposted, live on tape. I'm Hank Kalet, former editor of the South Brunswick Post. This is the first of what I hope will be a number of interviews done in a variety of ways on a variety of topics, focusing on South Brunswick Township. Today, I talked with Mayor Charles Carley about the township's response to the coronavirus crisis. Mayor Carley has graciously accepted my invitation to talk about circumstances that we're all living through right now in town. So, Mayor, let's start with an overview of what the township is doing during this crisis. I know most of our facilities are closed, the parks are closed, the park facilities are closed. What else is going on? What else do our residents need to know about?
Well, today is the first day that we have a testing facility open at our generation will recall it as the DMV, but the MVC, the MVC facility on Route 130. Always work in concert with your primary care physician. But if you feel and your primary care physician provider feels that you need a test for COVID-19, that facility is open now for testing. So that's something that we've been doing. The primary thing that we've been doing is disseminating information so that people can act in a way that we feel is appropriate in terms of keeping social distance, sheltering at home. The schools did a very good job on, I believe it was March 11th. They closed the schools down. We were closed down about a week before most other places were closed down. We declared a state of emergency locally that same week so that we could establish norms, the temporary new norms, I'll call it, where we could raise awareness that people should keep their distance from other people and stop, to the extent we can, the spread of the virus amongst our vulnerable populations.
Actually, you mentioned the vulnerable populations. Are there specific ways in which the township is addressing their needs? I mean, we're looking at people who may need help with food, seniors who are shut in, who are lacking that kind of human contact. Are there any things in particular you guys have put in place to try and ease it for them? Ease this thing for them?
Through our transportation department, which is a subset of the police department, we're distributing food to the folks that are in need through the food pantry, social services. As you know, Hank, the town government for years and years has had a robust social services department. That continues throughout this crisis. Actually, it's ramped up a bit. We've had good results when we've reached out to the public in terms of getting food supplies and also raising money. We have a crisis fund where if people have a hard time meeting their day-to-day bills, we'll give them a leg up. And so we've had good results throughout this crisis. The town, the town better than I do. I hate to say that, but that's the truth. It does step up in times of crisis. It's a good town.
Yeah, and when we're looking, I mean, the danger here is that, and the fear here is that with unemployment spiking the way it is, that even with that very robust response that we've had to the 2 food drives, that the need could quickly outpace that. So what are you hearing? I haven't talked to Jeannie specifically about that, but what are you hearing about that so far?
Well, the concern is even more than the pandemic is the economic fallout right now in terms of the food bank. You see the unemployment figures that were released nationwide yesterday, and each week, the last 3 weeks, as a nation, we're ramping up 6 or 7 million people newly unemployed. Our hope is that we don't end up like, you saw the video out of Florida where you have a 5-mile line of cars waiting to go to the food bank. our hope is that our state government ramps up quickly and effectively relative to unemployment in terms of making sure that people realize their unemployment benefit. You do pay for unemployment. It's not, a handout. It's unemployment insurance. Our hope is that the state government does an effective job filling those claims, and people aren't, without. But in the meantime, we have whatchamacallit, done a pretty good job. The food bank is full right now, so there's not a hunger problem in South Brunswick right now. If this thing drags on for months and months, I can't predict that. But I don't think this will drag out for months and months. I think it'll drag out for weeks and weeks. So I don't think we'll end up with a hunger problem out of COVID-19.
The last couple of days have been pretty rough in town. The two highest testing days,
Mm-hmm.
22 and 28, I guess, 50 people over the last 2 days, several deaths. Is this just because of the increase in testing that we're seeing, or it's just, we're a small town, so it's not like we are representative, but people are starting to see their neighbors contract this.
Yeah, I won't say that, because it is an up close and personal thing. I won't say that, it's expected, but on a per capita basis, we're doing relatively well when you compare us on a per capita basis to the other towns in Middlesex County, because people generally have been acting well in terms of sheltering at home and social distancing and those things. I have been surprised by our reaction to this crisis. At the beginning of March and of February, I was talking town hall with the chief, who's the head of the OEM, Office of Emergency Management, about the looming crisis we all saw coming. You saw it, everyone in town saw it coming. If you have 60 million people under quarantine in China, you understand that we're a global economy and it's going to get here sooner or later. And when we were sitting around talking, I said, well, geez, the Chinese, they can quarantine 60 million people. Well, what are we going to do? We're the United States of America, freedom of movement, freedom of expression. We're not disciplined like that. And, we basically, well, we're going to have to wait and see. The restrictions on freedom of movement here are essentially voluntary.
Right.
There's no one in the streets with a machine gun saying you shall stay in your house. But I can report that people are acting responsibly. It's been a surprise that people will, if presented with a set of facts, will digest those facts and act responsibly, and then move on with their lives to the best that they can. People have been, when they're diagnosed with COVID-19, have been quarantining themselves. The markets are generally, outside of that first rush, the great toilet paper craze of 2020, outside of that great rush, the markets are generally sparsely populated. The roads, we have very few incidents of car accidents now. The populace, us, you, me, everyone, all our neighbors, have been acting very responsibly, which has it shouldn't come as a surprise, but it really has come as a surprise. And I think that'll contribute to, Dr. Fauci always talks about flattening the curve, and that's to relieve the pressure on the hospitals. I know a couple of healthcare professionals, and they say the hospitals are so far managing well. So I think we'll end up getting better than expected results. And I think that although it's not the beginning of the end, like Churchill said, it's the end of the beginning.
Right. So, you mentioned the markets, and that's, the governor imposed some new restrictions on them. We have three major supermarkets in or along the edge of our town that our residents tend to use. Have you spoken directly with them at all about the kinds of the ways that they might put the governor's new edict into place?
Well, I know that the ShopRite had done that earlier, because they not our local ShopRite, but ShopRites generally had an incidence of COVID-19 amongst their workforce. Knowing people that work at the Stop and Shop in Franklin Park, not in Dayton,
Right.
their bargaining unit had gotten concerned early on, and so they had implemented measures there. If you go into the Stop and Shops now, you'll notice that there's plexiglass shields between you and the checkout folks, and that the people stocking the shelves have personal protection equipment. So they have implemented measures, visible measures. I was at the Stop and Shop the day before yesterday, and you can tell that things had changed dramatically week over week in terms of, again, the plexiglass between customers and the cashiers, and also the personal protection equipment that the folks stocking the shelves were wearing.
And in terms of, it's been hit or miss, I think, in terms of, in general for supermarkets, it depends on the time of day, I guess. I know that last time we were in ShopRite, it was packed, and I'm wondering if that's changed at all. But I guess it would be hard for you to say at this point.
It's hard to say. I know that, like you said, there's an executive order saying that advising supermarkets that they can't have customers more than 50% of their normal occupancy or their occupancy load.
Okay, and what else? What else do you think the residents can do? I mean, there's stuff that I guess the town can still has in its arsenal. I mean, the parks, we mentioned before, the parks themselves are open, right?
Yeah, for walking, walking paths and such. A while ago, we took down the hoops at the basketball courts and taped off the playgrounds because we didn't want a concentration of people in closed social spaces. But, speaking to our professionals and just intuitively, it doesn't hurt. Everyone's walking on the streets anyway. So what does it hurt to walk on a walking path?
Right.
So the parks are open.
Does it help that we're essentially a suburban community with that? For the most part, people have their own backyards and stuff. Is that?
Yeah. One of these days, after this is all over, sociologists will parse why there were terrible hotspots and why there weren't. Some of it will have to do with socioeconomic circumstances, I'm sure. Other parts of it will have to do with density. If you get in an elevator that you're sharing with 120 people, it's tough not to press the same button. But we don't have that situation here.
Okay.
We're spread out a bit more, and so I think that's helpful.
Okay. And what else? I mean, to go back to what I kind of shifted questions mid-gear, but what else? If residents ask, what else can we do as residents?
You know what? We're in the the springtime. It's the the holy season for a lot of our faiths. It has always struck me that part of the robustness of American democracy is the strength of our non-governmental institutions. So if your listeners can take a little time out and make a donation to either your houses of worship or some other institution, because right now those institutions they're closed. And when we're not paying attention to them, they still have to pay their electric bill, right? We all have to pay our electric bill. So pay attention to those things that ordinarily you would support. We're the government. You can't avoid, the old Ben Franklin, death and taxes.
Right.
We're gonna get our taxes.
Right.
But those other institutions that add to the quality of our lives and really are the backbone of, I think, of American democracy. I think you really have to spend a little bit of time thinking about them and supporting them.
Okay.
I will say that that the information that we're getting would indicate that because of the population with the social distancing, things are getting better. So we'll see ugly numbers probably until, I'm looking at my calendar, April 15th, not August 15th, God forbid, April 15th. We'll see very ugly numbers, and numbers are numbers until they hit you yourself. So the numbers will be tragic, but then things should start to improve based on the trend lines that have been established by you and me, and you in your den and me in my kitchen sitting at home.
Appreciate it. You stay safe. And we'll talk some more, hopefully, about other things besides this in the near future. So, okay. Thanks, Mayor. We'll talk to you soon.
Be good, buddy.
All right. Bye-bye.